Welcome to the press briefing today. We have on the panel Dr. Chuang Shuk Kwan, Head Communicable Disease Branch Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Hospital Authority. The two doctors will update you on the Hospital Authority and on the number of cases. First, Dr. Lau. Good afternoon. First of all, I would like to give you an update on the Hospital Authority. We have 2,556 patients staying in the hospital. Of those, 338 are new cases. As for patients in isolation facilities, 1,531 are in these facilities. 578 are in isolation wards. 185 are in second-tier isolation ward. 595 are in the North Lantau Hospital, Hong Kong Infection Control Center. 173 patients are in the AWE COVID Treatment Center. In total, 239 are new patients. Yesterday, we reported 11 patients were in serious critical condition and 9 in serious condition. And among the patients in hospital, in total, there are 52 in critical condition and 40 in serious condition. Of the 70 critical patients, 17 are in receiving intensive care. And then for the 17-month-old boy staying at the Princess Margaret Hospital, I would like to give you a follow-up report. The boy is now receiving intensive care in the ICU. His condition has become critical. Yesterday, our medical staff found that the boy started to suffer from fatigue, and he fell asleep all the time. And then we wanted to make sure he could breathe properly, so we intubated him and used the ventilation machine. But his heartbeat remains normal and he has no fever. As for death cases, we're reporting 4 new cases. All are females, aged from 89 to 101. 3 of the patients did not complete the 3 doses of vaccination. 2 stayed at a residential care home for the elderly. I'll go through the 4 cases briefly. First one, 101-year-old female staying at a residential care home for the elderly. She was immobile, and she had 2 doses of COVID-19 vaccine. She had history of hypertension. In 2004, she had breast cancer. She underwent surgery. The brain scan showed there were some signs of stroke. She also had dementia. On the 10th of August, she had fever and difficulties breathing. She was tired, feeling tired, and she went to the A&E department at Tim Mun Hospital. At the time, the test, the RAT result was negative, and then we did a PCR. The CT value is 25.8, and she was admitted to the medicine ward at that time. And there was still no signs of infection in the lung, and then he gave her antiviral drugs, and then eventually, because we found she couldn't eat properly, so we gave her intravenous saline solution, and then her CT value continued to drop, and then on the 21st of August, oxygen level in the blood dropped continuously, and then there were also opacities on her lung X-ray on both sides of the lung, and then we continued to give her medication, but she passed away yesterday. The second case, a 94-year-old female living with her family. She had no record of vaccination. On the 27th of August, she went to the Tin Shui Wai Hospital Accident and Emergency Department. She told us at the time that she had cough, phlegm, and she couldn't breathe in the past 2 days. And before she came to the hospital, she did an RAT, and the result was positive. Family members said that her response became slower. And then when we conducted examination on her, we found that she was, rather skinny and not well nourished. And then the PCR test gave a CT value of 15.2. She was admitted to the medicine ward, and then immediately we prescribed remdesivir, but unfortunately, she passed away not long after being admitted. She passed away yesterday. Third case, 89-year-old female, a resident at a residential care home for the elderly. She had various diseases on her scalp. She had a tumor. And she was receiving palliative care because no treatment was possible. And then she also had anemia and dementia. On the 11th of August, 17th of August, she was admitted to the Eastern Hospital A&E department. She had shortness of breath, and at the time the diagnosis was pneumonia. And then RAT and PCR results were all negative. She was admitted to the hospital, and while she was in hospital, on the 24th of August, we did a PCR test again. It's positive. The CT value is 33.7. We immediately administered 2 types of oral COVID medication, but unfortunately on the 28th of August, she passed away because of pneumonia. Fourth case, 91-year-old female. She lived with a helper. She had different diseases. She had a history of colon cancer. She had surgery, and then so there was also hysterectomy and so on. And she also had heart disease. Now she had fever, and then she felt really tired, and then an RAT result was positive when she went to a private hospital. That's why she was transferred to the Rottenji Hospital A&E department. Family members said that she did have appetite for 2 days and she wasn't feeling well, and then she was admitted to the hospital, and then we did a PCR. CT value was 19.2, and immediately oral COVID medication was prescribed. But then her CT value continued to go up. That means the viral load continued to drop, but unfortunately she passed away yesterday. Now I want to talk about patients who have recovered. In the past day, 230 patients recovered. Of those, 202 members were discharged, and 4 patients were tested positive from upon admission, screening, or in the hospital, and then 8 staff members and patients were listed as a close contact. 146 staff members confirmed, newly confirmed cases. 130 have returned to work. Now I'd like to talk about cluster in the medicine ward of the Prince of Wales Hospital. A 55-year-old male patient tested positive on the 11th of August. The hospital then conducted contact tracing and investigation. Eventually found another 8 male patients aged between 56 and 92 who were infected. We are trying to investigate any epidemiological link among these cases. All these patients are in isolation. The condition is stable. The reference ward has stopped receiving new patients and stopped any visiting arrangement. And then disinfection has been arranged. And then the hospital is also arranged for all patients and staff in the ward to receive to be tested. Hospital will closely monitor the situation of the patients, and the staff members will keep in close liaison with the CHP. Thank you.
Good afternoon. We have a total of 8,225 confirmed cases, 2,250 cases approved PCR, and 5,757 tested through RAT. We have 236, imported cases, 220 tested positive through PCR, and 56 through RAT. Of the imported cases, 129 were identified at the airport, and 28 cases were tested positive in quarantine hotels and at the quarantine centers. From day 4 to day 7, we have identified 65 positive cases. We have another 15 cases which were found from day 8 to day 10. Of the 230 cases, they have been imported from 38 places, 9 of which more than 10 cases, including Thailand 25, Philippines 24, UK 24, India 22 cases, USA 20, Singapore 18, Australia 13, Vietnam 12, Canada 11. Of the other 29 other places, there have been fewer than 10 cases imported. Like the talk said earlier, we have 4 death cases. The total number of death cases during the 5th wave is now 9,455. As of today, we have 7 elderly care homes and 2 homes for the handicapped, in which we need to actually isolate and certain persons. The Zhongxin Lau Mui Heng elderly care home, there is 1 resident confirmed positive and 3 residents have to be quarantined. The Bangoi Hospital, you have 3 tested positive. Phật Cao Bảo靜安老院, 1 resident and 1 staff confirmed, and 5 residents would need to be quarantined. Wu Yan Wu Lao Yun in Central and Western, with 1 resident confirmed positive and another resident would need to be quarantined. Tsinghua Wu Lao Ga, 3 residents confirmed positive and 9 other residents would need to be quarantined. Yanyang Kowloon Wu Lao Jiga, 1 resident and 2 staff confirmed positive. 14 residents and 6 staff would need to be quarantined. Wei Kei Yi elderly care home in Sam Shui Po, 1 resident confirmed positive and 4 residents would need to be quarantined. Tonghua Group of Hospital Jockey Club Yu Ging elderly care home, we have 2 residents and 1 staff confirmed positive. 47 residents on the same floor would need to be quarantined. The St. James Settlement Fuk Meng Kui Yu Wo Yun, 3 residents and 1 staff confirmed positive. The entire floor, the residents on the entire floor would need to be quarantined. As for schools, today we have 114 schools reporting 205 positive cases, which involve 153 students and 53 teaching staff. They come from 62 nurseries and kindergartens, 28 primary schools and 23 secondary schools and 1 special school. Of the 29 schools over the past 7 days have reported 2 or more positive cases. Today, we have some schools in which certain classes will need to be suspended for 1 week. The Yau Chai Yang Yin Yau Dai secondary school in Sai Kung, class 12A, 3 students have been found positive. They have a total of 20 students. The class will need to be suspended for a week. Ga Zhao Jin Day Tuen Mun kindergarten, 2 students have been found positive and classes will be suspended for 1 week. Kai Satin K1 kindergarten, they have 6 classes, 36 students, 2 students and 1 teacher confirmed positive, and the school will need to be suspended for a week. 明雅國際優異學校 in Tai Po, TG1 class, AM class. They have 30 pupils, 2 of whom and 1 teacher were confirmed positive, and the classes were suspended for a week. Island Christian Academy in Central and Western, class 2B, 12 of the 12 students, 2 students and 1 teacher found positive. Classes suspended for 1 week. Tongzhou Menji kindergarten, the PM class, one teacher and one student confirmed positive. There are a total of 15 students, and the class will need to be suspended for 1 week. Chan Yan Chun Yan Hong, nursery center, which is a special school, and in Wong Tai Sin. There are 14 students, and among whom one teacher and one student was confirmed positive. So this class will be suspended for 1 week. We all earlier had one school, Wai Si Kindergarten in Yau Chin Mong District. K2A class was suspended since the 25th. K1A and the other classes, there are also some other students who have been infected, so have been certain staff. So 14 students, 5 staff are now confirmed positive. There are 85 students and 19 staff. There are only 4 classes. For this school, we have asked them to suspend the entire school for 1 week. For the mutant strains, the sublineages of the virus, BA5.5 and BA.4, the ratio continues to climb. The samples collected on the 26th of August, BA4 has gone up to 54.8. BA.2.1 was 6.9%. Our lab has analyzed the specimens collected from the 22nd to the 28th of August through genome sequencing, and the BS.4 is about 12%, suspended. PA.5 was 88%. The remaining ratio is such that at the moment we suspect that BA.5 will make up about 46% of the total number of cases. Suspected BA.2.2 is 41.9. BA.2.1 is about 6.9. BA.4 is about roughly 6%. BA.5 strain, mutant strain, has now overtaken BA.2.2. During the time when the number of cases dropped a bit, after the RAT test, we would, also conduct the PCR test with the number of cases jumping up, and we have fewer than 1% of the fake positive cases, when the PCR test was taken after the RAT test. So we will go back to the old practice, that is, we will take random samples among those who have gone through the RAT. We take a certain percentage of those and conduct tests. We will monitor the proportion of the fake positive cases. If the number goes up again, we will step up the number of tests. Well, that arrangement, is effective since today. So it's now Q&A time. Please put up your hand if you want to ask a question and tell us the organization you represent. Cable TV. For the school will be starting soon, and the teacher will need to take RAT tests. So does it mean, do you expect there will be a major explosion when this school term begins? And is there a need to suspend the schools? We understand that many of the GOPC have been suspended. Many people didn't know that. Before, you only make the announcement one day before you close the GOPC. Wasn't that too hasty? Would the government consider, sending out messages to those people who need to go to the GOPC? For the elderly, people who are not tech savvy, would there be other ways to inform them?
I understand the Education Bureau has asked the teachers and students to start doing RAT 2 days before school start. We believe that is a prudent approach. Hopefully then we could identify positive cases early and prevent them from going into the school and start the transmission. Of course, we hope that students could still have face-to-face classes as far as possible. Well, as you would appreciate, for those who need to go to designated clinics, And also for those who need teleconsultation, the demand is becoming high and high because there are more positive patients, and many need to take oral COVID medication. So we want to devote more resources to designated clinics and teleconsultation. And that's why some of the general outpatient clinic services are affected. We need to make adjustment. We've actually announced that for different clinics at during different periods, there's need to reduce the scope of service or to shorten the consultation hours. Yes, we do appreciate that the public will be affected, but we ask for their understanding. Of course, you could go to our website to check the consultation hours of clinic and see which clinics have adjusted their hours. And if necessary, they could go to other clinics, or maybe some clinics may have already informed the public to go to another clinic to get medication. For the elderly, well, we hope family members will help them out. They may not know where to find the information. So we hope that the younger family members will help the elderly, and if they need to have go back for consultation, the family members will help them check whether the clinic hours are still the same, and so on. So please, we could all, work together, and then hopefully this epidemic, this wave will be over soon, and then we'll go back to normal. Next, please. I'm from Phoenix TV. A question for Dr. Chuang. Now, we have some 8,000 to 9,000 cases each day. Would the SAR government consider new infection control measures? And a question for Dr. Lau. Now, for the AWE COVID-19 treatment center, that's increase in occupancy rate. You will soon start another center. So what is the situation now? And if you have used up all the beds in the 2 halls, would you start another hall, and how will you operate these facilities? Well, you may note that a few days ago, our Secretary for Health has already announced some new measures. You could refer to the press releases a few days ago, and that's exactly because of the increase in the caseload. Sorry, can I clarify your question? You were talking about the AWE COVID treatment center, operating more beds there. Is that right? Okay. I think it was starting from last week for the AWE COVID-19 treatment center. The service started there. Initially, we started with 200 beds. We hope that more patients could be transferred to the treatment center, and then we could free up beds in hospitals for the more serious cases that need hospital treatment. As we announced yesterday, there are 173 patients in this center. So that means we're almost close to full occupancy. And we're now making arrangement to add more beds in the center, say to take the number up to 300 beds in total. Now, in that center, we could have at most 400 to 500 beds, but we are closely monitoring the situation, because if we, add more beds, that means we need more manpower, and then we'll have to deploy the manpower from hospital clusters. We hope that we don't need to start so many beds. That means we don't need to deploy extra staff there while we're able to take care of them. Other than the AWE, in each hospital cluster, we have already reserved beds that could be used to take COVID patients. As you know, for the 3rd stage, the number of beds will go up from 2,500, will be from 2,500 to 5,000 beds. As we've announced, we now have over 2,000 patients in different hospitals, 1st-tier isolation ward, 2nd-tier isolation ward, or the Hong Kong Infection Control Center, or the IAWE. And our prediction is that as the epidemic continues to worsen and there are more positive cases, then more people will have to be hospitalized. We hope very much we don't need to adjust our other services so much or in short, we don't want to reduce non-emergency services so much, but then when we don't have a choice, then maybe for some wards, such as the orthopedic wards, obstetric wards and other wards may have to be turned into wards for COVID patients, and that means our staff will be deployed to look after COVID patients. So all I could say is this: please be understanding with our arrangement, and for those who are affected, we hope very much we'll be able to provide them with the necessary service soon. Next. To the left, second last row in the middle there. Yes, I'm from Now TV. Question for the hospital authority: the 17-month-old boy. Yesterday you said you adjusted down the oxygen level. Today he needs to be put on the ventilator and he is in a critical condition. Have you assessed why the patient has become more or less unconscious or so? And then now schools will start soon, but then there are more cases involving young children now. So for child patients, what arrangement do you have for them, and how many pediatric beds are there for COVID patients? Second question is about the Siyao kindergarten. For that particular kindergarten, is the case that students don't have to go to school during the summer break. When was the last time students went to classes, and was there a transmission in the kindergarten? Why so many people became infected there? And would you, the Health Bureau would talk to the Education Bureau to adjust your guidelines for suspending classes? Say if cases go up to over 10,000 cases a day, then there will be suspension of full-day face-to-face classes. Now, for Weisi Kindergarten, they have classes. They are not in a summer break. We are closely monitoring the outbreak at that kindergarten, and if necessary, we'll decide what else to do. For the 17-month-old boy, yesterday, the doctor found that he became more tired. There was less time when he's awake. Now, we know that if he's not awake enough, then long enough, it's possible that he could choke or he might not breathe so well. And so doctors wanted to protect him and intubated him so he could be put on a ventilator. But then the doctor's trying to find out what other conditions he may have. For example, there will be a brain MRI and so on. And also he had convulsions before. When he had convulsion, he couldn't breathe so well, and we suspected he stopped breathing for a while, whatever. So that could be one of the reasons too, because there are so many problems. So that's why the doctor has to find the causes. And at this point, what is most important is that we protect this child first. We wanted to make sure that he can breathe properly, because we don't want to have acute pneumonia. So, now on reserving beds for COVID patients. For the 2,500 to 5,000 beds reserved for COVID patients, they include beds in the pediatric wards. As you know, for pediatric beds, they don't account for the highest proportion in the hospital because we don't have a high fertility rate in Hong Kong. So what we're doing now is that in hospitals, we would designate adult wards. So if pediatric wards are full, then we'll use the beds for taking in child patients. We have specially trained nurses who they have received training at pediatric wards, so they were able to take care of the child patients if necessary. So we will watch the situation closely. If there are more children being admitted, we'll be providing more beds for them, so they will have proper treatment. But we, it all depends on the actual situation. But what we are doing is that we have already designated particular wards and reserve manpower for this purpose.
Next one, last row, the lady at the far end. First of all, Well, some experts said that BA.4 and BA.5, if the rate goes up to 80%, we're going to have 20,000 confirmed cases. Is that within the expectation of the government? For the current round of the epidemic, will the situation be more serious than it was in February and March? For the number of reinfection, is that at a low level? For the people who have been confirmed positive, do the antibodies in the body, be able to withstand the BA.5 strain? So, is it that the expected reinfection rate will stay at a low level? You talk about the St. James Settlement, Yuen Mong Gui. The entire floor had to be quarantined. I'd like to know how many residents are involved. And for the schools, for the YC kindergarten, you said that 14 students and 5 staff have been infected. Is it because they joint facilities, and that's the result of the reason for the transmission? And there be any BA.5 cases in this school? Which elderly care home are you referring to? Could you give us a name again? The St. James Settlement, kindergarten, elderly care. We're still, taking the count at the moment because we now have more cases, and we believe that there is a risk involving that floor, but we still don't know what the actual number is yet. Regarding the kindergarten, we have made inquiries and we've not been able to identify any high-risk factors, such as whether they have school buses, or we don't have any activities where the staff and the pupils are together. But since a larger number is involved and there is a transmission, but we still don't know. For reinfection, I think the number is about 1 to 2%. It has slightly increased compared with the early days of the 5th wave. I think it's been almost 6 months now, and the immunity of some of the level for many people have dropped. Question in English.
A few questions from the SCMP. For Dr. Zhang, as the caseload has dropped to around 8,000 today, what are the possible reasons? Did it drop because of the lower testing capacity during the weekend? And if the caseload exceeds 10,000, will the government further tighten the social distancing rules? And for Dr. Lau, as there are only 80 to 90 hospitalized patients who are in critical and serious condition now, can the HA explain why the rest of the 2,000 patients are still staying at the hospitals? And what is the admission and discharge criteria for COVID patients now? And will HA further loosen both criteria to free up beds and ease the pressure on healthcare system? Thank you.
I think the number one day, a bit lower number today, may not reflect the actual trend, because we do have day-to-day variation in number in the past. And I understand that government will closely monitor the situation and, if necessary, may have other measures.
For the critical and serious cases, yes, the number of critical and serious cases at this moment is less than that in the early 5th wave. It is a good news. Yeah, maybe it is because the vaccination rate is increased after the initial 5th wave, especially in the elderly population and in the OH home residents. Because in the 5th wave, we observed that most of the critical and serious cases are the elderly, especially from the elderly home. So with the effort from the government as well as from the OH home staff, the number of OH home people receiving vaccinations is increased a lot after after the initial fifth wave. For the admission and discharge criteria, we did admit the patients who need to be cared in the hospital. For example, for the elderly who have multiple chronic illnesses with shortness of breath, fever, we worry that the patient may deteriorate a lot after going home. So we will admit the patient. But for the patient who are young and fit and can be isolated at home or in the isolation facilities, they will not be admitted. For the discharge criteria, we followed the discharge criteria of the CHP according to the vaccination status and as well as the result of the rapid antigen test. But we add the PCR, the test for the patients, the COVID patients who will be discharged back to the for residential care home, including the residential care home of the elderly as well as the residential care home for the disabilities. One more point is we observed that in the early fifth wave, the injection rate of the OH home is lower. But now what we observed that is the injection rate of the elderly who admit to our hospital from the community has lower vaccination rate. So we want to advise our elderly as well as the relatives, please bring the elderly to have the injection as soon as possible, especially those without the first injection. If the elderly have already received the first injection, please give the second as well as the third injection as scheduled as soon as possible. Thank you.
我補充翻頭先。
Also like to supplement on the rehab center Yipminggui of the St. James settlement. There are about 26 residents who need to be evacuated. Next.
We have to follow the instructions of the CHP. Now we follow the instruction of CHP to discharge the patient according to the vaccination status as well as the result of the rapid antigen test. But we have increased the safety margin by adding the PCR test for those COVID patients who are discharged back to the residential care home of elderly as well as disabilities.
Next. Second last row to the left.
TMHK. Today, Professor Lau Yulong predicted that cases could reach up to 20,000. So what does Dr. Chuang think about this? Do you have similar predictions? And some said the Education Bureau is requiring students to test themselves for 2 days before going back to school. Why is this so, and why is it necessary to do it? And also, why is the CHP relaxing the rules to only carry out random sampling of people who tested positive using rapid tests? Like, has the increase in case numbers put a burden on the testing capacity? Thank you.
I do not have any prediction on the cases in the peak. I respect the expert opinions. I understand the Education Bureau asked the students and staff to do 2 rapid tests before they go to school. I think this is a prudent measure to prevent the spread of infection into the school once the school commenced. For the spot check of the rapid antigen test, one explanation why we do that is because of the low false negative rate so far we have tested. And the second, of course, is because of the rapid increase in number of the tests we have to do. So we have to be more efficient in the use of our laboratory testings.
下一位，左手邊最後嗰行嘅戴深藍色口罩。
Next, to the left, I'm from Mingpao. About the 17-month-old boy Professor Lau Yulong said that the child had a CT scan but not MRI. Have you done all the examination? And is his drowsiness has anything to do with his brain? Now he could it be because of intubation? And it's nothing to do with he's critical because of intubation, but not to his illness. And you said you're going to increase the number of places for compulsory testing, but we've seen no change. So in the past 2 days, there's been no restriction testing declaration cases. So is it because you think that it's not going to help infection control? That's why you're not doing it, or will you be stepping up such effort? Now, Dr. Chuang said you will not be checking each and every RAT declaration. So what, how many false and positive cases will you set at the level before you will do checks again for all the cases? Now, for 153 students, 53 teaching staff, total 206 positive cases. So you said the tick figures didn't tell, but actually they do. For restriction testing declaration cases and compulsory testing cases, I understand the Bureau is going to discuss with other Bureau. If there are any changes, they will say so. On spot checks, starting from about May, now at the time there were fewer cases to start with. And then we also found that the false positive case proportion was high, some 20 to 30%. So there were false, we suspected false reporting. That's why we started spot check. At the time, we were able to check all the RAT positive cases. But recently, RAT positive cases have gone up much. And we see that the false positive rate remains low. So it's within our expectation, but if it exceeds that, then we will consider more checks. For the 17-month-old boy, we suspect whether there's any brain condition leading to drowsiness, but then there are many reasons for drowsiness. So that's why we will first do an MRI. We're waiting for the report, actually, of the MRI. I don't have the report at hand. I don't know what the results are. Now, of course, if he's intubated and he needs a ventilator, then he will be classified as critical, but then his vitals remain normal. To the left, the lady there. I'm from Hong Kong Economic Times. On spot checks, what sort of percentage are we talking about in terms of false positive cases? Before you do checks, and then for false positive cases, have they to do more with the elderly, and which groups will you do spot checks on in particular? For the 17-month-old boy, is his CD value going up or down? What is his viral load like, and which strain has he got? And what sort of medication have you prescribed, and what are the results? For the deaf case, 89-year-old female, she was sent to the hospital on the 17th of August, and then on the 28th of August she tested positive. So are there other cases in the ward? And then a member of the public said that she's been admitted to the Penny Bay Isolation Center, but there's no treatment given to the person. So what is the situation like with Penny Bay? Now we check about half of the cases today, but then this percentage may change if there is a much higher case load. And of course we'll have to watch the false positive case rate. So far we don't spot any particular trends in relation to the false positive cases. I'm afraid I don't have the latest CD value for the 70-month-old boy. The first CD value was 20-something, the second 18 or so. I don't have information about the mutant strain 2 with this boy. For the third death case, I think we made announcement before. I think there's some in-hospital infection cluster, so that patient could have been one of the patients affected by that cluster. As for Penny's Bay, there are two types of services now provided at the Penny's Bay. First type is for those who are asymptomatic, who are young, who could take care of themselves. And then when they're admitted, we'll check what the condition is like, and then we'll give them a phone number. And if necessary, they could call that phone number. One phone number is for the civil aid service, on daily necessities, or if they have questions for medical advice, there's another phone number, so they could call if there's a need to ask the questions. And there's another type of service which you've heard about in the past few days for those aged 60 or above, or those who've had 2 or fewer doses of vaccine, the elderly in particular. They will be placed in the sections of Penny's Bay where there is elderly service. These units have been modified for the elderly. So there are handrails, there's also the call bell, and if they could press the bell and if in case of an emergency. And then all these units are on the ground floor. That means they don't need to go up a floor climbing stairs. And then we also have medical teams with nurses managing this small districts. In other words, we will regularly check on the elderly patients there to see if they have a problem. Now, usually those in the Penny's Bay are those with no serious symptoms or problems, because if we spot any problems, we'll transfer them to hospitals or AWE Treatment Center or the Hong Kong Infection Control Center at the first instance. Another advantage of them going to Penny's Bay is that they could start receiving the oral antiviral medication, because as long as they're age 60 or above, even if they don't have any symptoms or just mild symptoms, we will start administering the oral drugs. This will prevent them from prevent the condition from becoming serious. Because we see that for elderly persons who have not completed the 3 doses of vaccine, if they stay at home, they may not know how to seek medical treatment, or they may not get medication. And we've seen from some of the fatality cases, elderly patients' condition may deteriorate rapidly. They may not know how to seek help, and so by the time they're sent to hospital, they may already have no signs of life. And so that's why we want to send them to the Penny's Bay, and we could take care of them, and we can monitor them, and then we could protect their health. Last question from the gentleman over there. I'm from AM 730. Now, there's mentioned that some of the general wards also taking in COVID patients. So are we talking about the total number of patients in hospital minus those in treatment centers? Then for the 1,000 or so, they are the one in this general wards, right? And you say, depending on the number of child patients, you will turn some of the wards into pediatric wards. Is it up to individual hospitals, or are you looking at it clusters by hospital clusters? For RAT, negative positive cases, is it the case that since end of May, the number of false positive cases remain at low level, or is only now is about 1%? And if people are sent to isolation centers and then it's found it's a false positive case, and what about risk control? How do you manage that? And then for public and private hospitals, or for private hospitals, do they have different criteria to go by in admitting COVID patients? Can you tell us a bit more? Now, for RAT, the negative positive rate drops to a very low level very soon. by false positive. I'm just saying that maybe at a time when they reported the RAT result is positive, but then we arranged a PCR test and then the test result may be negative. And so it may not be a confirmed case because, with RAT it's possible. Of course, we've seen rapid surge in the number of positive cases. That's why we believe spot checks would be more effective. You mentioned false positive cases being admitted somewhere. Now,
I think the isolation facility in there, they will not be mixed up with the other positive cases. If they only found through PCR to be negative, then we will take out that case and the person can be sent home. Now, the question was that in our hospitals, we have certain wards which will be converted to, wards specifically to take in COVID patients. We have tier 2 isolation wards which have been converted to accept COVID patients. Well, these wards have been reconfigured earlier with improved ventilation systems so that they can admit these COVID patients. You have 2,500 odd patients and 1,500 in quarantine facilities. The 2,500 means that for the last 28 days, if they will be counted if they were among the those who have already recovered, but for certain reasons they are still at hospital after they have recovered. For example, there's something wrong with the heart, or they may need to undergo a surgery or operation. So these will be included. But if we discover that there's a chance of transmitting disease, they will be put in quarantine facilities to ensure that they will not infect other patients. For the pediatric wards, the first thing is that, of course, we will make use of the pediatric wards because they are designed to admit, pediatric patients. We will first want to make use of these facilities. If we have more children admitted to the hospital, we will need to use beds for adults, some of which have been designed to take in COVID patients. For each hospital and each cluster, they will monitor the situation and the demand. Most importantly, at our headquarters, we have a senior level command center. We will know exactly for each hospital and each cluster what is the usage rate of our hospital beds. We hope that for our 7 clusters, they will jointly form one single cluster. So if in a particular hospital or cluster, if there is a shortfall of pediatric beds, then we will transfer the children who are infected in that district to another, cluster which have more, such beds, so that we can, shorten the time for admission. And that's why we've set up this high-level command center to do this. As for the private hospitals, according to my recollection, we have 200 odd patients who have been admitted to private hospitals. I found that we have 217 patients who are non-COVID patients transferred from public hospitals to private hospitals. We have, at the moment, 21 stable cases of COVID patients which are follow-up at the Chinese U Medical Center. each private hospital will talk to our clusters and the headquarters regarding the criteria for admission of our patients. Basically, we hope that some of the patients who are in convalescence or who are in recovery, they will receive treatment in private hospitals. For example, they've already undergone an operation, they're only recuperating, or if they have a heart disease, and after treatment they would need time to recuperate, and these are the first batch that we would like to transfer to the private hospitals. For our larger hospitals, these patients are taking up some of our acute hospital beds. If we could, transfer them to the private hospitals, then those acute beds could be used to admit, patients which required, treatment. That's all for our briefing today. Thank you very much.